38-year-old female, and the most fun I've ever had in dentistry was this case. A 38-year-old female, she was missing 2 front teeth. She was born without these 2 teeth, so we call them lateral incisors. So this tooth here and this tooth here, they were missing. We talked about different ways in which she could fix it. She was very compliant and amazing, and she went through a very complicated orthodontic treatment to open these 2 spaces up so we could place implants. And getting the spaces exactly the way we wanted was extremely challenging, and God bless her, she was very patient and amazing. And when she came to see me, to finally put crowns on the implants and restore them and finish the implant crowns, she kind of had enough and wanted it done ASAP because she had enough dentistry. And I don't fault her for that at all. So when we took impressions and we put the implant crowns in, and we tried them in, and she was very displeased about the way they looked. She was okay with the way that this one looked, but she really didn't like the look of this. Now, if you look at the gums, it's blanching a bit. It's not really what it was supposed to look like. But what she was upset about was the gum line. And if we look, and if I pull up the tissues, you can sort of see this is how this one looks. But the gum line here, just based on how the implants had to be placed, there's an asymmetry. So when she smiled, the gums looked really good here, but not necessarily the same here. And that was what was throwing her off. So we talked about different ways of doing it. The easiest, simplest way for me to fix this would have been go see Dr. Inger, our periodontist, and just get her to do a little revision. We'll redo the crowns. However, no surgery. She was fed up. No more surgery, no surgical processes. I don't like this, find another way. Okay. So what I did was kind of cool. And to her credit, I said, be patient with me, let's give this a go. It's kind of hard for me to show you this, but what I started doing was I would see her almost every 2 to 3 weeks. I would take off this implant crown, and I would add filling material at the gum line to almost push the gums up. She would wait in my office until the gums stopped being white, and we got color back. I said, go home, and she came back, and week after week after week after week until we got the gums exactly the way we wanted. But this was what the final result was. So if we can see, the gum line here is symmetric with the teeth around it, and I think we literally had an incredible job. We got an incredible result that I think everyone was happy with.